These are 15 warning signs that your kidneys could be failing silently right now. And most people miss every one of them, from the earliest, barely noticeable changes to the late-stage symptoms, never realizing what's happening or what to do until it's too late. More than 35 million adults in the US have chronic kidney disease, and approximately 9 out of 10 don't even know it. Millions with kidneys slowly failing, unaware until advanced stages when dialysis looms. In this video, we won't just list symptoms. We'll walk you through kidney disease progression from silent whispers to late-stage alarms, explain why they happen, and give you a clear action plan. You'll discover 15 warning signs organized by stage, exact tests to request, and evidence-based actions to protect your kidneys starting today. Here's something important. 2 extremely common diseases are responsible for more than 70% of all kidney disease cases. You probably have at least one yourself or someone else you know. Comment kidney health if you're ready to take this seriously or share your experience. Your story could help someone else recognize the warning signs. Let's start with the earliest, most subtle early signs of kidney disease. Stage 2. The whispers. Early warning signs. Sign number 1. Changes in urination patterns. If your morning urine looks foamy like beer, or you're waking up multiple times nightly to urinate, despite not drinking extra fluids, your kidneys might be sending their first distress signals that most people completely ignore until it's too late. Your kidneys contain approximately 1 million microscopic filtering units called nephrons, each with a glomerulus that acts like a fine mesh strainer. When these filters become damaged, they allow larger molecules like protein to leak through into your urine, creating persistent foam that doesn't dissipate even after flushing. Simultaneously, damaged kidneys lose their ability to concentrate urine overnight, forcing frequent nighttime urination called nocturia that disrupts sleep and daily function. Research on foamy urine has shown that among patients complaining of foamy urine, approximately 22% had overt proteinuria, and about 32% had microalbuminuria or overt proteinuria, making it a clinically significant indicator. Those experiencing nocturia more than twice nightly have been shown to have increased risk of progressing to more advanced kidney disease stages. Foamy urine is often dismissed as insignificant, but it represents albumin leakage, a critical early marker that the glomerular filtration barrier has been compromised, explains Dr. Harold Feldman, Emeritus Professor of Biostatistics and Epidemiology at the University of Pennsylvania, Perelman School of Medicine, and director of the Chronic Renal Insufficiency Cohort Study. Pay attention to your urination patterns. If you notice persistent foam that doesn't dissipate after flushing, or you're consistently waking 2 to 3 times nightly to urinate, document these patterns for 2 weeks and schedule an appointment with your primary care physician to request a urine albumin to creatinine ratio test. Have you been dismissing frequent nighttime urination as just getting older, when it could actually be your kidneys' first cry for help? But here's what's fascinating. While your kidneys are sending signals through your urine at night, they're also communicating through a completely different part of your body that you see every single morning in the mirror. Sign number 2. Puffy eyes and swollen ankles. Those persistent puffy circles under your eyes each morning that don't improve with better sleep, or the subtle swelling around your ankles that leaves sock marks deeper than usual, might not be from too much salt at dinner. They could be early indicators that your kidneys are losing there to regulate fluid balance and retain essential proteins. When kidneys become damaged, they begin allowing albumin and other proteins to escape into urine instead of remaining in your bloodstream, where they create oncotic pressure that keeps fluid inside blood vessels. As blood protein levels drop, fluid leaks from your circulation into surrounding tissues, accumulating first in areas with loose tissue like around the eyes, and in gravity-dependent areas like the ankles. Research published in the Clinical Journal of the American Society of Nephrology has found that patients presenting with new-onset periorbital edema, eye puffiness, combined with lower extremity edema, have a substantial probability of having undiagnosed chronic kidney disease, with many already at stage 3 or higher by the time they seek medical attention. Early edema in kidney disease follows a characteristic pattern. It's bilateral, meaning both sides are affected equally. It's pitting, meaning pressure leaves a temporary indent, and it progresses from periorbital in the morning to pedal by evening as the day goes on, notes Dr. Suzanne Watnick, professor of medicine in the Division of Nephrology at the University of Washington, and former chief medical officer at Northwest Kidney Centers. Monitor yourself for persistent morning puffiness around both eyes that doesn't resolve within 30 minutes of being upright, or ankle swelling that leaves visible indentations when you press your finger into the skin for 5 seconds. If present consistently for more than 1 week, this warrants immediate medical evaluation, including kidney function testing. Could your body be retaining fluid in these specific locations because your kidneys can't maintain the delicate balance between fluid in your blood vessels and fluid in your tissues? Now, if you're experiencing swelling, and this next symptom together, it's an even stronger indicator that your kidneys need immediate attention, and it's something that affects your ability to function every single day. Sign number 3, persistent, unexplained fatigue. If you're experiencing overwhelming tiredness that isn't explained by poor sleep, demanding work schedules, or stress, fatigue so profound that simple daily tasks feel exhausting, and you need frequent naps despite sleeping 7 to 8 hours nightly, your kidneys might be failing to perform one of their critical secondary functions that most people don't even know about. Healthy kidneys produce erythropoietin, EPO, a hormone that signals your bone marrow to produce red blood cells. As kidney function declines, EPO production drops dramatically, resulting in fewer red blood cells to carry oxygen throughout your body, creating what nephrologists call anemia of chronic kidney disease that causes profound persistent fatigue that exercise and sleep can't resolve. Studies have found that patients with eGFR, estimated glomerular filtration rate, between 45 to 59 milliliters per minute per 1.73 square meters, considered stage 3 a kidney disease, had reduced hemoglobin levels compared to the normal range of 13.5 to 17.5 grams per deciliter, with many reporting moderates to severe fatigue that significantly impacted their quality of life and work productivity. What makes kidney disease-related fatigue particularly insidious is its gradual onset. Patients adapt slowly over months or years, attributing their declining energy to aging, stress, or depression, when in reality their kidneys are failing to stimulate adequate red blood cell production. Note nephrologists specializing in chronic kidney disease management. If you're experiencing persistent fatigue despite adequate sleep, especially if accompanied by pallor, pale skin, cold intolerance, or difficulty concentrating, request a comprehensive metabolic panel including eGFR and a complete blood count (CBC) to check hemoglobin levels. Catching anemia early allows for EPO-stimulating medications before transfusions become necessary. Research shows that addressing kidney disease-related anemia early not only improves energy and quality of life, but also slows the progression of kidney damage itself, creating a beneficial cycle that protects your remaining kidney function. But here's where it gets interesting. That same kidney dysfunction causing your internal fatigue is also creating visible changes on your skin that most people treat with the wrong solutions for years. Sign number 4, dry, itchy skin that won't respond to moisturizers. Those patches of persistently dry, itchy skin, particularly on your back, arms, or legs, that don't improve with expensive moisturizers, hydration, or humidifiers might seem like a minor annoyance or simple dry skin, but they could be your body's external manifestation of internal kidney dysfunction that's allowing toxins and minerals to accumulate at abnormal levels. As kidneys lose their filtering capacity, phosphorus levels begin rising in your blood because damaged kidneys can't excrete excess phosphorus effectively, while simultaneously the balance of calcium and parathyroid hormone becomes disrupted. These mineral imbalances, combined with the accumulation of uremic toxins in your bloodstream, trigger intense, persistent itching called uremic pruritus that affects a substantial percentage of dialysis patients, but often begins years earlier in mild kidney disease stages. Research in the Journal of the American Academy of Dermatology has indicated that patients with stage 3 chronic kidney disease who reported moderate to severe pruritus had elevated phosphorus levels and were significantly more likely to progress to stage 4 compared to those without itching, suggesting that pruritus serves as a clinical marker for accelerated kidney function decline. Uremic itching has a characteristic quality. It's deep, burning, and particularly intense at night. It often affects the back and extremities bilaterally, And most importantly, it doesn't respond to antihistamines or topical treatments the way allergic or dermatological itching does, notes Dr. Gil Josipovic, professor of dermatology and director of the Miami Itch Center at the University of Miami Miller School of Medicine. For persistent itching that doesn't respond to moisturizers within 2 weeks, especially if accompanied by other kidney disease symptoms, ask your doctor to check your phosphorus levels, calcium levels, and parathyroid hormone as part of a comprehensive metabolic panel. Early intervention with phosphate binders and dietary phosphorus restriction can often resolve the itching while protecting remaining kidney function. Have you been treating unexplained itching with lotions for months, not realizing it's a window into your kidneys? Those first 4 signs were whispers, subtle changes. As kidney function declines, the body talks louder with more noticeable symptoms that often send people to the doctor. Stage 3. The talks, more noticeable symptoms. Sign number 5. Muscle cramps and restless legs. Frequent muscle cramps at night, especially symptoms of kidney problems in feet, calves, and thighs, or an irresistible urge to move your legs might indicate declining kidney function, disrupting electrolyte balance. Kidneys regulate potassium, calcium, phosphorus, and magnesium. As function deteriorates, these minerals become imbalanced, disrupting muscle contraction. Research has found that patients with more advanced stage 3B kidney disease experienced muscle cramps significantly more frequently compared to those with normal kidney function. Request a comprehensive metabolic panel. Monitoring these markers is crucial to avoid dialysis progression, but muscle cramps are just the beginning. As those electrolytes and toxins continue building up, they start affecting something even more fundamental to your daily life, your relationship with food itself. Sign number 6. Loss of appetite and metallic taste. Gradual loss of interest in food combined with persistent metallic or ammonia-like taste is often uremia, the toxic state developing as waste products accumulate. As kidney function declines below 40%, blood urea nitrogen, BUN, and creatinine levels rise, affecting taste buds and triggering nausea. Studies have shown that stage 3B to 4 patients with taste alterations consumed substantially less protein than recommended, well below the recommended 0.8 to 1.0 grams per kilogram, and had significantly higher rates of malnutrition and faster dialysis progression. And here's the disturbing part. That metallic taste and loss of appetite is often just the warning sign before the digestive problems become impossible to ignore. Sign number 7. Nausea, vomiting, and digestive disturbances. Waves of nausea unrelated to anything you've eaten, or persistent indigestion that gastric medications don't resolve, might be gastrointestinal manifestations of advancing kidney disease. Uremic toxins irritate the entire gastrointestinal tract, slow gastric emptying, and trigger the brain's vomiting center directly. Research indicates that stage 4 patients experience high rates of nausea, frequent vomiting, and significant gastroparesis, with severity correlating directly with BUN levels above 60 mg per deciliter. Insist on kidney function testing before extensive gastroenterological workup. Now, while these toxins are wreaking havoc on your digestive system, they're simultaneously attacking another critical organ. And this next sign affects millions of people who have no idea it's connected to their kidneys. Sign number 8. Brain fog and difficulty concentrating. Finding it difficult to focus at work, forgetting conversations, or noticing complex tasks feel overwhelming might indicate your brain is responding to the toxic environment created by declining kidney function. As kidneys fail to clear uremic toxins and maintain electrolyte balance, these waste products affect neurotransmitter synthesis and directly impair neuronal function. Research has found that stage 3B to 4 patients performed significantly worse on cognitive testing, with a substantial percentage meeting criteria for mild cognitive impairment. Request formal cognitive screening and comprehensive kidney function testing. Everything we've covered so far, the whispers and talks, these are warning signs you can still act on. But when warnings are ignored, kidney disease screams for emergency intervention. These next signs mean you're running out of time. Stage 4 to 5. The screams. Severe, late-stage signs. Sign number 9. Shortness of breath and fluid in the lungs. Progressive shortness of breath that worsens when lying flat, forcing you to sleep propped up, might indicate your failing kidneys are allowing dangerous fluid accumulation in your lungs. Advanced kidney disease causes fluid overload. Kidneys can't excrete adequate salt and water, while low albumin levels allow fluid to leak into lung tissue, creating pulmonary edema. Studies have shown that stage 5 patients not yet on dialysis experience significant incidence of pulmonary edema, with those reporting orthopnea being much more likely to require urgent dialysis soon after. Seek immediate emergency care for any progressive shortness of breath or difficulty breathing when lying flat. But as terrifying as fluid in your lungs sounds, this next sign is something most doctors only read about in textbooks. A sign so severe that if you see it, you're looking at kidney failure's final stages. Sign number 10. Uremic frost. In extremely advanced untreated kidney failure, patients develop uremic frost, a white crystalline powder visible on the skin representing urea crystals precipitating from sweat when urea nitrogen exceeds 200 to 300 milligrams per deciliter. This occurs only when kidney failure is so profound that death is imminent without immediate dialysis, though it's now extraordinarily rare due to earlier diagnosis. If you or a family member notices this crystalline powder, this represents a life-threatening emergency requiring immediate emergency department presentation. While uremic frost is what you see outside, this next sign reveals what's happening inside your brain when toxins reach critical levels, and it's often reversible if caught in time. Sign number 11. Severe neurological symptoms. In advanced kidney failure, patients may develop serious neurological complications, including confusion, disorientation, seizures, or even coma, called uremic encephalopathy. This occurs when BUN exceeds 150 to 200 milligrams per deciliter, alongside severe acidosis and electrolyte imbalances, causing altered mental status, asterixis, flapping tremor, and seizures. Research shows that patients with uremic encephalopathy typically have severely elevated BUN levels, with most showing significant neurological improvement within 24 to 48 hours after starting dialysis. Confusion or seizures in someone with kidney disease demands immediate emergency evaluation. Kidney disease doesn't just damage kidneys, it creates a vicious cycle with another organ system, and this next sign might be why your blood pressure medications suddenly stopped working. Sign number 12. High blood pressure. That's hard to control. If your blood pressure is climbing despite multiple medications, your kidneys might be creating a cycle where kidney damage causes high blood pressure, which then accelerates further damage. Damaged kidneys release excess renin, constricting blood vessels and retaining sodium, while losing their ability to excrete excess salt and fluid. Studies have found that a majority of stage 3 to 4 patients have hypertension, with those having uncontrolled hypertension progressing to dialysis significantly faster. Have you ever had someone tell you your breath smells unusual even after brushing? This next sign is your body exhaling kidney failure through your lungs. Sign number 13. Ammonia breath. Persistent ammonia or fishy breath odor that mouthwash can't mask represents uremic toxins literally being exhaled through your lungs. Uremic fetor signaling advanced failure. When BUN exceeds 80 to 100 milligrams per deciliter, oral bacteria break down urea into ammonia, creating distinctive breath odor, typically appearing with eGFR below 20 milliliters per minute per 1.73 square meters. If you can smell ammonia on a patient's breath, their kidney failure is advanced and urgent intervention is needed, explain nephrologists specializing in advanced kidney disease management. Those toxins don't just affect your breath and brain, they can attack your heart. This next sign is why kidney disease leads to thousands of ER visits yearly. Sign number 14. Chest pain and pericarditis. Sharp chest pain that worsens with deep breathing or lying flat indicates uremic pericarditis, inflammation of the heart's lining from uremic toxin accumulation. This occurs when BUN exceeds 60 to 80 milligrams per deciliter, and uremic toxins directly irritate the pericardium, causing inflammation and risk of cardiac tamponade. Studies have found that uremic pericarditis occurs in a notable percentage of advanced kidney disease patients not yet on dialysis, with most showing complete resolution within 1 week of initiating hemodialysis. Any chest pain in someone with kidney disease requires immediate emergency evaluation. Here's our final sign, one many people experience for years without connecting it to their kidneys. If you've been told you have osteoporosis or had unexplained fractures, this might explain why treatments haven't worked. Sign number 15, bone pain and fractures. Persistent, deep bone pain in the hips, knees, and ribs, combined with increased fracture risk, reflects renal osteodystrophy, bone disease caused by chronic mineral imbalances. As kidneys fail, phosphorus accumulates while calcium drops, triggering parathyroid hormone release that pulls calcium from bones, weakening bone structure. Studies have found that stage 4 to 5 patients had hip fracture rates substantially higher than the general population, with many reporting bone pain. Request testing of calcium, phosphorus, vitamin D, and parathyroid hormone levels. You've now seen all 15 signs, but here's the critical question: what actually causes this kidney destruction? Let me show you the 2 silent killers responsible for more than 70% of cases and how you can stop them. The 2 main culprits, diabetes and high blood pressure. The 2 conditions responsible for more than 70% of all kidney disease cases are diabetes and high blood pressure. In diabetic nephropathy, elevated blood glucose causes glomerular basement membrane proteins to become glycated, making it leaky, while triggering inflammatory pathways that progressively scar the glomeruli. This process takes 10 to 20 years, but can be dramatically slowed with glucose control, keeping HbA1c below 7%. Research shows that maintaining optimal HbA1c levels significantly reduces diabetic kidney disease risk, notes Dr. Catherine Tuttle, Executive Director for Research at Providence Inland Northwest Health and Professor of Medicine at the University of Washington. In hypertensive nephrosclerosis, years of uncontrolled high blood pressure cause the kidney's blood vessels to develop thickened walls, reducing blood flow to nephrons, which atrophy and scar. Maintaining blood pressure below 130 over 80 millimeters of mercury and HbA1c below 7% can reduce the risk of progressing to dialysis by substantial percentages over a decade. Your action plan. What to do next to avoid dialysis? Immediate action number 1. Schedule a medical appointment within 1 week. Call your primary care physician or nephrologist directly, emphasizing any signs of kidney failure, kidney symptoms, and risk factors. Immediate action number 2. Request these 3 essential tests. Specifically, request 1. A comprehensive metabolic panel including eGFR, estimated glomerular filtration rate, and creatinine levels. 2. A urine albumin to creatinine ratio. And 3. A complete blood count to check for anemia. Studies show that patients who received kidney function testing earlier had better outcomes, helping them avoid or delay dialysis. Immediate action number 3. Implement evidence-based lifestyle interventions to improve kidney function. Begin these 3 actions. 1. Reduce sodium intake to less than 2,300 milligrams daily. A natural kidney cleanse approach. 2. If diabetic, keep blood glucose below 180 milligrams per deciliter after meals. And 3. If hypertensive, work toward blood pressure below 130 over 80 millimeters of mercury. Consider incorporating foods that heal kidneys. Leafy greens, berries, fish rich in omega-3s, cauliflower, and whole grains. Aggressive lifestyle modification can slow disease progression substantially compared to standard care, notes Dr. Matthew R. Weir, Director of the Division of Nephrology at the University of Maryland School of Medicine. This is how to improve kidney function naturally before dialysis becomes necessary. So now you know, kidney disease whispers before it talks, and talks before it screams, giving you multiple opportunities to intervene and protect your kidney health. Remember, kidney symptoms alone can't diagnose chronic kidney disease. You must get tested checking your creatinine and eGFR levels to catch warning signs of kidney failure in earlier stages. Chronic kidney disease is often preventable, yet patients continue starting dialysis emergently because they never had simple screening tests that could have detected early signs of kidney disease years earlier. Kidney disease detected at stage 3 or earlier and treated aggressively often prevents or delays dialysis significantly. Watch this next: the 10 biggest black seed oil benefits you've been missing for years and how to use it right. Discover another powerful natural remedy that supports kidney health, reduces inflammation, and works synergistically with the kidney protective strategies we've discussed. Drop kidney health in the comments if you're committed to taking action. Scheduling appointments, requesting tests to check creatinine and eGFR, or implementing lifestyle changes. Your kidneys deserve protection, and I'll see you in the next one.